A very good day. So the next topic for discussion in autonomic nervous system is receptors in autonomic nervous system. Now in the last lecture video, I already told you there are two types of autonomic nervous system. One is parasympathetic and another is sympathetic. Okay, now let's start with receptors involved in parasympathetic nervous system. Now in parasympathetic nervous system, there are two broad categories of receptors. One is muscarinic receptors and the second is nicotinic receptors. Now in this table, I've shown you the muscarinic receptors and there are 5 subtypes, that is M1, M2, M3, M4, M5. Now in these muscarinic receptors, the odd numbers, that is M1, M3 and M5 are basically GQ subtype of G-coupled protein receptors. And GQ subtype means their second messenger is IP3-DHE, that is diacylglycerol cascade, and they also cause influx of calcium. Whereas the other set of muscarinic receptors, which are even numbers, that is M2 and M4, are basically GI subtype of receptor. GI means inhibitory type of G-coupled protein receptors. And what actually they do is they inhibit adenyl cyclase. So upon inhibition of adenyl cyclase, there is decrease in cyclic AMP. Now, as for the sympathetic nervous system is concerned, all the receptors are divided into alpha and beta. Now, in alpha, you have alpha 1 and alpha 2, whereas in beta, you have beta 1, beta 2, and beta 3. Now, alpha 1 is basically GQ subtype of G-coupled protein receptors. And GQ again, it means IP3-DHE cascade and influx of calcium. Whereas alpha 2 receptor is GI subtype of receptor, where it inhibits adenyl cyclase and it causes decrease in cyclic AMP. Whereas the beta receptors, now there are 3 types and all the beta receptors are actually GS subtype of G-coupled protein receptors. Now S means stimulatory and it causes adenyl cyclase activation, which leads to increase in cyclic AMP. Now one of the receptors which I have not mentioned here is nicotinic receptors. Now nicotinic receptors is one of the subtype in parasympathetic system. Now nicotinic receptors, they are of 2 types, NN and NM. Now NMM means muscle and they are located in neuromuscular junction, whereas NN is located in the ganglions. And all these nicotinic receptors are actually ion-linked receptors, means they are the ion channel and the conducting ion in those channels is sodium. So now I would like to brief you about the location of these receptors. Now let's begin with parasympathetic system. In the parasympathetic system, the muscarinic receptors. Now in these muscarinic receptors, M1, M4 and M5, they are actually located in CNS and they have varied functions and a lot of the functions are still not known. Now what we are interested is in the other 2 receptors, that is M2. Now M2 receptor is specific for heart and the vagus supply to the heart actually causes decrease in the heart rate, that is bradycardia, and this is actually mediated by M2. Whereas N3 receptors, now N3 receptors, if you see, they are present in all the smooth muscles, and N3 basically activation will lead to activation of this smooth muscles, and they cause contraction of the smooth muscles and as well as the motility. And that's why you see wherever these N3 receptors are there, they stimulate the smooth muscles and they cause the contraction, and not only that, it increases the GI motility. And even if you see M3 receptor which is present in the anal wall, it causes contraction of the anal wall, and also it causes contraction of the urinary bladder. But at the same time, these M3 receptors are also present in the sphincters like bladder sphincter and anal sphincter, where it causes relaxation of these sphincters. Now let's talk about the location of the alpha 1 receptors. Now if you see, alpha 1 receptors are also present in the smooth muscles, and their major action is contraction of these smooth muscles. Like for example, they are present in the radial pupillae, where they cause contraction of the radial pupillae muscle. They are present in the erectropylae smooth muscles, and they cause contraction. And other areas where they are present is in the sphincter of both urinary bladder as well as anal canal. And here basically they cause contraction of the sphincters. Now the other location which is very important for alpha 1 is the blood vessels. In the blood vessels, basically alpha 1 receptor activation will cause vasoconstriction. And the overall effect of the vasoconstriction, as you know, it increases the blood pressure. Now beta 2 receptors, these beta 2 receptors location wise, they are mainly present in again in smooth muscles, but their actions are exactly opposite to M3 of parasympathetic system. As you know that M3 causes contraction of the smooth muscles. If you see beta 2 they are also present in the smooth muscles, but they cause relaxation of the smooth muscles. Let's take an example. The important locations are bronchial smooth muscles, it causes dilatation. And if you look at the blood vessel smooth muscles, there it also causes relaxation. So it causes actually vasodilatation in the blood vessels. And they are also present in the whole GI tract, beta 2 receptors, and they cause relaxation of the GI tract, and it inhibits the GI motility. And in the detrusor muscle, it causes relaxation of the detrusor muscle, and same way in anal wall, it causes relaxation of the anal wall. And not only that, the final smooth muscle is in the uterus. In the uterus, it causes relaxation of the pregnant uterus. All right. So now let's move on to the other beta 2 receptors where they are present. Like beta 2 is also present in the liver. In the liver, actually, it causes glycogenolysis, gluconeogenesis, and also increases the output of glucose. So this is again sympathetic effect in the liver, which is actually mediated by beta 2 receptors. And as for the beta 1 receptor is present, beta 1 is mainly present in the heart. In the heart, it causes increased force of contraction, conduction, as well as the heart rate. Now, other sites where beta 1 receptor can be found in the eye, where it causes secretion of the aqueous humor. It can also be present in the salivary glands, which can make salivary secretion very thick. And apart from that, they are also present in the kidney. In the kidney, their major role is to release renin from the juxtaglomerular cells. Whereas beta 3 has very limited role, and the main role of beta 3 is to stimulate lipolysis. So here we finished the receptors which are involved in autonomic nervous system. We discussed about the receptors, we discussed post-receptor mechanism, the type of G-coupled protein receptors involved, and the second messengers involved, and also we briefly discussed the locations of all these receptors. Thank you very much for listening to this session. Goodbye.